Being significantly overweight can affect your physical, mental, and emotional health. Dr. Volkman from U of U Health joins me now to share more information on this. Glad you're here today.
Thanks for having me here.
You and I were just chatting. The pandemic has been hard on emotional health and also on our weight for a lot of people.
Yeah, it's been a struggle.
It has been a struggle, and losing weight can be terribly hard.
It is hard. That's why we're here. When people try to lose weight multiple times and they can't do it, that's why we have bariatric surgery.
Let's talk about what bariatric surgery is.
Bariatric surgery is weight loss surgery. There are multiple different types of weight loss procedures. They're meant for individuals who are, generally speaking, over 100 pounds overweight. That would be a body mass index of 40 and higher, or 35 with a weight-related medical problem. That's just a ratio of your height to your weight. There are all kinds of body mass index calculators on the internet.
Okay, and the first one we're going to talk about is gastric bypass. What happens in a gastric bypass?
In gastric bypass, we divide the stomach. We turn the top part of the stomach into about the size of an egg by stapling and dividing it. Then we divide the intestine and basically bring up a limb that we connect to the pouch. It's very effective. It helps patients lose about 60–80% of their excess body weight. Most patients tend to keep the majority of that weight off in the long term. It's been around since 1967, and we know it's highly effective and works very well. And
it stays like that, right? Your stomach stays like that?
It does. We're essentially rerouting your intestines, kind of changing the plumbing around. We don't remove anything during the procedure.
And then these patients, their health gets better because they lose a lot of weight.
Yes, absolutely. Weight-related medical problems, as you might think, they get better.
High blood pressure, a lot of those things.
High cholesterol, diabetes, joint pain, osteoarthritis, sleep apnea. It generally improves many weight-related medical problems, even cancer risk. And patients, most importantly, they feel better. Starting around 3 months after surgery, patients start to feel much better.
There's also another surgery that you do.
Correct. That's vertical sleeve gastrectomy or sleeve gastrectomy. It's currently the most commonly performed weight loss procedure in the United States, although we don't have as much long-term data on that operation.
And what happens in this one?
In this operation, we turn the stomach into a long, narrow tube. So we remove about 80% of the stomach. So in that operation, we actually remove things rather than rerouting things. We're operating only on the stomach.
What do you hear from your patients when they lose weight and they just feel healthier?
Yeah, they say they feel great. They say they have a lot more energy. It's really great. I tell our trainees that I'm in one of the few surgical subspecialties where I get to follow patients long term, and they're getting healthier and better. A lot of happy patients. They're happy to get off their medications. They're a lot more active, do things that they never thought that they would do before. It's a very gratifying job.
Dr. Volkman, is there an age that people do this, or is it any age that people do this?
Well, at our program, we begin offering surgery above the age of 18, so legal adults. And we operate on patients up to the age of 70, sometimes over. It depends on the individual and their overall health status. The average age of most patients tends to be in their 40s, 30s, but we certainly operate on patients in their 20s and 70s and up, depending on how healthy patients are.
And it can really improve your quality of life. If people are thinking that they would be interested in this surgery, do they need to come have a consultation with you?
Yes. Normally we start out with having them watch an information session that's available through our website. It's a recorded information session. Prior to the pandemic, these were live, but we have a recorded session that patients can watch, answer a few questions, and then we set them up for an appointment.
And that's how you can get the information for that free seminar. You can find more information on Instagram and Facebook and the University of Utah website. So thank you so much for being on the show.
Thank you very much.
Appreciate it. Thanks, Dr. Volk.